So hi everybody, my name is Heidi Galarza and today's topic is Romosozumab in postmenopausal women with low bone mineral density. So definition. Sclerostin is an osteocyte derived inhibitor of osteoblast activity. The monoclonal antibody Romosozumab binds to sclerostin and increases bone formation.
Risk factors for osteoporosis include being female, being older, postmenopausal, of Caucasian or Asian background, having a low dietary calcium and vitamin D intake. Treatment options for osteoporosis include calcium and vitamin D, and those are, of course, the mainstay of all treatment. Mm-hmm. But additional choices that we have available include bisphosphonates, teriparatide, and denosumab. There's a new drug in the pipeline. It's a monoclonal antibody known as Romosozumab, which is a very exciting treatment option. It's an anti-sclerostin antibody that increases bone formation. The Romosozumab study was published earlier in 2014 in the New England Journal of Medicine. This was a dose-finding study. After a one-year period of time, the Romosozumab increased bone density to a greater extent than the best treatments that we currently have, including teriparatide and alendronate. Well, I think it's important for physicians to think about the diagnosis of osteoporosis, especially in elderly patients and also in those who've had a fracture. It's important to think about the diagnosis and order a bone density to measure bone mass and then initiate treatment. It's important for physicians to be aware of current treatments for osteoporosis, but also to realize that new treatments are on the horizon which likely will be even better than the ones we currently have.
So, application in medicine. This study evaluated the efficacy and safety of Romosozumab in postmenopausal women who had low bone mineral density. So it's very important. Pros. All those levels of Romosozumab were associated with significant increases in bone mineral density at the lumbar spine. And cons. Patients present non-recurrent injection site reactions with Romosozumab. Adverse events were similar among groups. So, disease. We'll lose some bone mass as we age. Bones naturally become thinner, called osteopenia, as you grow older, because existing bone is broken down faster than new bone is made. So all this occurs, our bones lose calcium and other minerals and become lighter, less dense and more porous. This makes the bones weaker and increases the chance that they might break. So it's a fracture. With further bone loss, osteopenia leads to osteoporosis. So let's see this video, which explains a little bit more the difference between osteopenia and osteoporosis.
Here's a question from a viewer. What is osteopenia? This is a great question because there's a lot of confusion on the difference between osteopenia versus osteoporosis. Osteopenia means that you have bone mineral density that's lower than the normal peak bone mineral density. The thing that osteopenia can potentially turn into is osteoporosis, which means you have a medical condition such that your bone mineral density is so low, you're at increased risk of complications. Those complications include fractures of the wrist, hip, and spine. Now, the way your bones normally grow and develop is that as you're growing up, your bone mineral density gets higher and higher until you reach the age of about 25 to 30. Then after then, and once you become middle age, your bone mineral density actually starts to decline. Now, as people become much older, they can develop osteopenia, the lower bone mineral density, or even osteoporosis, where they have increased risk of complications. Usually these have no symptoms, but they can be detected by x-rays. The best test to detect this is a dual absorption x-ray test called a DEXA scan. And this is done.
So, let's see a little bit more about the test.
Here's her story.
I'm here at St. Jude Medical Center. I'm here for my osteoporosis scan.
Hi, Deborah. Sanjay Chopra. Nice to meet you. The area that we're looking is the L4, L1 area, the low back, lumbar spine, the neck of the femur, as well as the head of the femur. These are the areas at greatest risk for fracture.
Okay, Deborah, I'm going to have you just go ahead. You're going to have a seat on the table here.
I hope my results will be perfect because I exercise and I try and eat foods that have a lot of calcium, and I try and have a high-protein diet.
Okay, Deborah, so the last part of this is going to look at both hips.
And it's quick and easy.
Yes, thank you very much.
My pleasure.
So when will I be hearing my results?
Deborah is here with us today, along with Sally, and first things first, you're anxious, right?
Yes, very anxious.
So shall we just cut to the...
Absolutely.
Okay. So, look up there. You see that little dot where it says normal in the green range? That's where you're at.
Yay!
Your effort was fantastic.
Yay! That's what I wanted. High five.
Good things.
Yes. Good.
And that test, Lisa, if you can hold those bones up, quite simply is measuring your bone mineral density. In Lisa's right hand, that's good bone mineral density. In her left hand, it's very porous, and that is the bone of someone with osteoporosis. Yours looks like the denser one.
The good one.
That
I
is
like it.
good.
Yes, that's
Now,
great.
having said that, we're going to talk about ways to prevent yourself from ever sliding into the zone of osteopenia or osteoporosis. Because it doesn't mean that you can never move in that direction. So strong bones for life is the key, right?
Right, but again, the onus again is to identify people who have the risk factors or signs. If you see, back pain, stoop posture, something like that, you want to identify again people who are at high risk, their family history, their age, if they've been taking medications like steroids or cancer treatments, if they have hyperthyroidism, other medical disorders that can make your bones. And it's not necessarily a disease of menopausal women or older women, or actually even Caucasian women, Black women. Everybody can be affected
Everybody
by
should
this.
get a bone density test
Absolutely.
at some time in their life,
Well, then-
probably as
right.
they turn into their early
Well,
60s.
gynecologists recommend, I
Yes.
recommend to all my patients that you get it at 50, or at least when you start menopause,
Yeah.
1 year after menopause. So that's when you should actually have the screening.
Yeah.
Okay, but the fabulous thing is that you don't have to worry about treatments. You have been taking a
Yes,
treatment, right?
yes,
And you've been taking
thank God.
your bones, even though they started to get like this, are now
Yes.
reversed because of a treatment that you're taking.
The treatment that I've chose, there are many different treatments to choose from, and the one that I take, which is once a month, has made my bones in that healthy zone again.
What medication did you take?
I'm on Boniva because it's
Okay.
once a month, but like I say, there are many effective treatments. They also have one that can be given intravenously that lasts for 3 months, I think, for women who can't tolerate anything digestively.
That's excellent, Sally. I mean, I know everybody wants to take what Sally's taking, and there's so many different treatments out there as well, though. Hormone replacement actually helps build bones as well, even though it's not indicated. There's so many treatments out there.
So it was a very, very interesting video. Now, I want to know a little bit more about what happens if I don't take medication faithfully.
One of the big problems we're discovering is not that the drugs are a problem. It's that people are a problem. People stop their medicine. If you get prescribed one of these drugs and you stop it after 6 or 7 months, you're not going to get any long-term benefit. It's only going to work if you take it. Your grandmother could have told you that. And we've got lots of data that show us that when people take their medicine less than half the time, it doesn't do anything. If you take a bisphosphonate 50% of the time or less, at the end of a couple of years, there's no fracture benefit. You don't reduce fracture risk. If you take it 75% of the time, you start to see a real benefit. If you take it 100% of the time, it's even better. Logical. So if you're going to take it, you got to take it.
And the last video explains us how we can prevent osteoporosis and osteopenia.
Hi, I'm Charlotte Lawson, a registered and licensed dietitian here in Tampa Bay, Florida. And I'm here to give you a couple tips on how to maintain strong and healthy bones. Well, bones are made up of a couple different nutrients, your phosphorus and calcium. And you can get those through your diet. But it's also very important to incorporate a good amount of vitamin D, as vitamin D is really proven to help utilize that calcium absorption. Calcium is also really affected by our vitamin C content, which is possibly why you've seen maybe orange juice fortified with that calcium. So a good combination of fruits and vegetables and low-fat dairy, for instance, which has a high source of calcium, are excellent things to incorporate when looking for good bone health. Now, other things to think about are your exercise program. It's been proven that weight resistance, or sort of weightlifting exercises, if you will, are again proven for strong bone density. The more weight exertion we put on our body, the more our frame has to work to carry that weight, and again helps to mineralize and densen those bones. So between the combination of vitamins and minerals and a good exercise program, you should be looking at some strong and healthy bones. Keep in mind, about 1,200 milligrams of calcium are recommended for the average adult, about 1,000 to 1,200, depending on where you're at in your age level. If you're a little bit higher in age, you're probably at an increased risk for osteoporosis and would need some higher calcium levels. And if you're through adolescence, you're also going to need some higher levels, closer to 1,400 milligrams per day. Now again, like I mentioned before, vitamin C and vitamin D are excellent things to have in your diet with that calcium. So hopefully between your well-rounded diet and a good exercise program, you'll stay strong and healthy. I'm Charlotte, and eat happy. Hi, I'm Charlotte Lawson, and
Sorry. So thank you very much for watching, and see you next time.